please. Thank you. But let's give them a round of applause to fuel them as they sign, because this is a money-making contract for all parties. It's win-win. Can we show them? Let's see the document. Open up. Yeah. Come on, round of applause. It's a historic moment. Thank you very, very much. Come on, Marcofi. I can't hear you. I can't hear you. We're the ladies in new relations. Come on. Yeah. Thank you very much. Thank you.
$700 billion every year as per records given by the African Development Bank. Of that, 30 billion goes into Egypt, 5 billion to Nigeria, 9 billion to Morocco, between $3 to $5 billion gets into Kenya, into Ghana, and into Ethiopia. So the diaspora, one would say, is the new sheriff in town, because the resources they bring into the country is twice all foreign direct investments put together, and it's 3 times all all development assistance that comes into the country. And yet the money that comes into the country from studies that our people have done, we had one of our members in Norway do her master's in this topic, found that it's only 5% that comes in, meaning 95% remains outside. Part of what we are doing is to create a pathway so that the remaining 95% that's being invested outside can come into the African Kenyan economy. Indeed, our target is within the next 5 years to double the remittances. So even if another 5% comes in, we are talking 10%. And we want to encourage diasporas to invest back home. Why are we doing this? We know the returns are best back home. Take, for example, a place like Japan, where we work together with Kija. Kija is the Kenya's Japan.
You can buy health insurance from home, and people like BUPA and Jubilee, and be able to use it back where you are. And that really makes your life much easier. You don't have to be frustrated, because all you need to do is walk into a hospital, and with a cover as high as $3 million, which is the cover, for example, for BUPA, you can actually pay and then walk with a card to any of the providers across the world, not just in the US, but in the UK and other places. Now, for the diaspora people who have relatives back home, you can buy for them Jubilee insurance covers, which means that you don't have to keep sending money. You can now just send premium upfront. And the diaspora people send nearly 800 billion shillings every year. Some of that money is for healthcare. Now, instead of sending money for healthcare, you can actually be sending money to take care of people. So you send money up front, and then you just give them a card, so which means you don't have to be called all the time. So this program with Kenya Diaspora Association takes care of you as a diaspora member, and also takes care of your family back home. And that is what we're trying to do, is we're trying to professionalize the engagement. So it's not just people call you when they're sick, but now you pay for the insurance up front, and then now you know they're taken care of. So you only have one conversation once a year, and we're very proud of our partners, BUPA, who have a global international plan. They have 2 million providers across the world, 2 million providers. So you can go, I don't know, some of us, when we get insurance, we get an Excel worksheet with providers. With BUPA, you have 2 million providers on that Excel worksheet. So across the world, any country in the world, Jubilee, for the people who are back home, you can actually get cover for your family. So that's what we are launching today, and we think it's very, very transformational and important.
Mm-hmm. Your future plans? Do you have a future plans to expand? So
obviously, future plans is, one is obviously before we go to other product training, the KDA 2069 organizations, showing them how these things works, ensuring that payments are made on time, how to pay, how to claim, and ensuring that is done. The next year we'll be launching something else with the Kenya Diaspora Association, and for us it's more of just the entire 360 degrees. Healthcare is first, then now we'll talk about wealth building and other things next year, but we do look forward to engaging. Watch this space. Thank you very much.
and Jubilee from a local health perspective is exactly what we want to do, which is bring quality healthcare cover to Kenyan nationals both at home and overseas. So actually this is really powerful for us. It speaks to our values and it speaks to our purpose of investing in Kenya.
What is the difference of these two Kenyans
You know, you would have heard me say earlier that health cover is the most important level of protection you can buy with one another, right? So, and to do that, you know, most health insurance companies can give you a list of benefits on a piece of paper that says we're going to cover you for X limits. That fundamentally, that's not what matters. What matters is the quality of the service that sits behind it, the trust, the guarantee that actually what you're buying is quality and you can trust it. Now, BUPA is one of the most trusted global brands from a healthcare perspective. We are an absolute expert. We're driven by clinicians. We're not owned or managed by shareholders. So our purpose is really true in terms of healthcare provision. So actually this kind of initiative is so important for us because it means that we get to live our purpose and value and help Kenyans both at home and overseas get quality healthcare. And that's absolutely what it comes down to, is providing quality healthcare. You know what we've identified, it's not about having money, right? That matters when you have a health incident. It's about knowing that you have access to specialists who know where to take you if you fall ill. So where is the best hospital in Rwanda? Where is the best hospital in Nigeria? Great question. So, you know, we invested in Kenya, and as I said, we're the first and only to do that from a global perspective. We genuinely believe Kenya will become the center of excellence for medical provision, right? So it is strategically placed, the market is mature, the regulation is improving, so our insurance regulator is really good at understanding insurance. And we believe that actually from a diaspora perspective, from a continent perspective, Kenya offers the best platform to become a provider of excellence in terms of medical provision. That is why BUPA is investing directly here. So we are now capitalized, we've invested, we've shown our commitment to this market. Okay.
And in Africa, you can get easily 2-digit returns, 10%, 12%. In fact, one of the products we interact with gives up to 24% per annum return. But let me also say that some of the projects we work with, we do North Africa in particular, with the diasporas in collaboration with the German government in the GIZ. We've seen micro and small enterprises that witness between 200 to 400% growth within 2 years. So our encouragement to diaspora is that this kind of return is only possible on the African soil. Maybe finally, we do realize that if we want diasporas to bring more money home, they say, and no, with a light touch, I don't want to compare them to dairy cattle, but even dairy cattle, when you want to milk it well, you feed it well, you even play music. The diasporas will find one of their major problems is health issues or bereavements, and we want to take away that load off them. That's why we are so delighted. We've been running for the past 3 years in collaboration with Absa Bank and Dr. Africa. We've been running
the launch of the group medical cover to cater for the Kenya Diaspora Alliance. Now, why this is big is because the diaspora already sends quite a bit of remittances back home. Quite a bit of this is for healthcare, and we want to be able to support them more proactively. Every phone call they receive for those they've left back home, every other message they receive can really be unsettling. So what we are doing today here, coordinated by Kenya Diaspora Alliance, is launching a group medical cover for their members, and this will be, Jubilee will take care of the local covers in terms of all of those who are being covered locally within the 47. Any other person, your mother.
The great privilege of the fact that as Jubilee, we have a lot of medical personnel. I think some of them are even in the room here. Dr. Musa Misieni is a medical doctor by profession. He is the chief operating officer of the business. I can see a couple of the others, but I do not